Dr. Wells, welcome to Health Connection. This is your first time and we're glad to have you.
Thank you.
Our topic, as a matter of fact, our title is The Mammography Study Heard Round the World. You're a radiologist. Mammography is a part of your brief. Explain the recent research study published, it was in the British Medical Journal, that calls into question the value of mammograms. Why is this particular study significant?
The study is significant because of the interpretation of the study and the recommendations from the authors and other reviewers that screening mammography may not indeed be beneficial to the women in the 40 to 49 year range. It is significant in that it may actually dissuade women from having screening mammograms when they should, in my opinion and the opinion of many other radiologists.
We've been told for decades that women should have annual mammograms. Why should they pay attention to this one study?
Well, any study that is done has some merit, and it's our responsibility to look at all studies and to determine what merit that is. Now, some studies can lead to misinformation, and they're all subject to interpretation. I personally don't feel that the results of this study are meritorious.
Is there anything about this study, I think you answered this question, is there anything about this study, its results, or the way it was conducted that causes you concern? I think you just said yes, or should we just take it at face value?
No, it shouldn't be taken at face value. There have always been questions about the way the study was done. It was done in the early 80s. It was performed with secondhand equipment that wasn't even state-of-the-art at that time. It was performed by technologists who hadn't been specifically trained in mammography positioning. It was done with less views of the breast than are obtained now. And probably most importantly, the images were interpreted by radiologists who had had a month or less training in interpretation of mammography. Significant study limitations. The other serious concerns had to do with how the women were allocated to the two arms of the studies. And some feel very strongly that the pure basis of randomization was violated by women having breast examinations before going into either study or either arm of the study. So there are significant questions.
Well, based on what the study says and based on your experience and your belief, is it fair to say that some breast cancers are being treated through surgery, chemotherapy, radiation that don't need such aggressive treatment?
It's fair to say that. We all know, all physicians know, that there are some cancers that can develop in men or women in any part of the body that wouldn't necessarily result in death of the patient. But the problem is that we don't know what those cancers are. We can't identify those. And so there's no question that there are cancers that we find that are very early that, had they been left alone, may not have caused the patient's death or mortality.
Very well. What's led to this? What's brought about this overtreatment?
Better screening technique, much better mammography equipment, much more awareness of breast cancer in this country and around the world. The October month dedicated to breast cancer awareness. Government involvement with stricter regulations about which centers are certified and which ones aren't, so that the techniques are much better, and we're finding cancers very, very earlier.
Well, that's a good thing. I mean, at least on paper, we find them earlier, but what's the downside to finding them earlier?
Well, again, we don't know at this point which of those cancers would have caused that problem, that patient great problems. We don't know which of those cancers would have resulted in death. By the same token, we also don't know which of those cancers would have resulted in significant morbidity. And morbidity meaning problems related to treatment, surgery, radiation, chemotherapy. We just don't have those answers.
All right. So then how do women and their doctors decide? How do you determine what the best course of treatment is when you have a diagnosis of breast cancer?
Well, now the diagnosis of breast cancer, if it's already established, that's fairly well documented now, how to treat
All right.
If you're referring to how to determine which women should have mammograms,
All right.
that's the big question now.
And what, if you were making the call, what would you say? What would be the factors you would consider?
Well, I would adhere to the recommendations from the American Cancer Society, the American College of Radiology, and the Society of Breast Imaging, all of which are in agreement that women should start having screening mammograms at age 40, and every year until they're not or no longer healthy, as long as they are healthy. Now, that's for women of average risk for developing breast cancer in their lifetime. Women who are at greater risk for whatever reason, whether it be a strong family history, whether it be genetic differences, need to be screened earlier.
Now, the study we were talking about here dealt with screening mammograms. Those were purely a prophylactic screening. What about diagnostic mammograms, where a woman has found a lump and her doctor needs to know what it is?
Well, that's a totally different thing. And when a doctor finds a lump in a patient who is less than 30 years old, we will generally do ultrasound first,
right,
not mammography. Between 30 and 35, depending on the family history, we may perform mammography at that time. A lot of it depends on the patient's personal history, the family history, breast density, and again, genetic factors.
What advice would you give to a woman hearing about this research study with respect to the value of mammograms?
My advice would be to talk to your doctor. Most patients trust their doctors and their opinions. My advice would be that there are a lot of studies that have been done to show that screening mammogram does indeed reduce the mortality of breast cancers. Since the 1980s, there's been a 30% decrease in breast mortality in this country. That may have to do with screening. It may have to do with better treatment. I believe it's a combination. I would say that there are lots of studies that would have been done elsewhere. The Swedish two-county study that involved 133,000 women in the late 1970s showed a 30% decrease in mortality. That's 50% or 50,000 more women than were involved in this Canadian study. So that the Canadian study is one study among many that called into the question the value of screening mammography. There are a lot more studies that, in my opinion, clearly show the validity of screening mammography.
Very well. How do you think this one particular research study may affect women's health care in the future? Do you think we'll see any changes?
I hope not. I think that it could have a very negative effect on women's health if it is taken at face value. If there is publication of the study in the media, and there has been, obviously, but that if women don't understand the problems with that study and understand that there are two sides to every discussion, that talk to your doctor, talk to a radiologist if you'd like, talk to people involved in breast imaging to reach a conclusion.
Very well. Doctor, very interesting, and thank you very much for your time.
You're quite welcome.